Hi, I'm Dr. Keithley. I'm a family physician at a local community health center where I'm the obstetrical lead, and I also have a master's in public health. I wanted to talk to you today a little bit about what to expect if you're pregnant or going to be giving birth during the time of COVID-19. First, let's talk a little bit about prenatal care. Instead of having all of your visits in the clinic, now your provider might choose to do some of your visits in the clinic and some of them over the phone. This is to try to help keep you safe. It is especially important now to stay at home, shelter in place, and avoid unnecessary contacts. Please remember to leave your house only for essential errands, and when you do, try to maintain a safe distance between yourself and other people. It's now suggested that everyone wear at least a simple cloth mask, such as this one, which covers your nose and your mouth whenever you are leaving the house, inside a building, or going to be within 6 feet of other people. The reason behind this is if you have COVID-19 and aren't aware, this will help decrease your risk of spreading it to other people. If everybody does this, we hope to decrease the spread in our community at least a little bit. Next, I wanted to talk to you a little bit about what to expect if you're giving birth during the time of COVID-19. Most women choose to give birth in a hospital, and hospitals are now limiting non-essential people into their hospital to try to decrease the spread. So please be aware of this and choose one support person to come with you. Just so that you know, no other visitors will be allowed to the hospital even after you give birth to your baby, so please plan ahead for this. The reason is to try to help keep everybody, including you and your baby, safe. When you go to the hospital, both you and your support person will be required to wear a face mask. We understand that this may be hard to keep on while you're in labor or pushing, and your healthcare provider will work with you. Hospitals and birth centers in Sonoma County provide birth care to try to be in accordance with the preferences of the mom and her family. If you have a fever, cough, or other symptoms of COVID-19, please call ahead so that your healthcare team can help prepare. Please also be aware that the majority of cases of fever in someone who's pregnant or about to deliver are not caused by COVID-19 and are most likely from another cause. So please let your provider know so that you can be evaluated and treated as appropriately. This approach is safest for both the pregnant woman and her infant. Next, I wanted to talk a little bit about what to expect in the rare case that you have COVID-19 or are suspected of having COVID-19 at the time of your birth. Some steps that you and your provider might take to help keep you and your baby safe are the following. First, we'll have you and your support room person be in a special ventilated room. Second, you will be given the option to isolate your baby at time of birth to try to prevent giving them COVID-19 or keeping the baby in the room with you. If you decide to keep your baby in your room with you, we'll take extra precautions such as keeping the crib 6 feet away, extra hand washing, and making sure to wear a mask when you're touching the baby or breastfeeding. Third, if you choose to separate your baby to try to decrease the risk of COVID-19, they'll be cared for either by a nurse or by your healthy support person. It's important to know that COVID-19 is not spread through breast milk, so you may continue to breastfeed your baby if you choose, or if you choose, use a breast pump to express your breast milk and have a nurse or your healthy support person feed your baby. If you do not have COVID-19 during this time, you can expect your birth to be mostly normal, but your whole healthcare team will make sure to take extra precautions to try to keep you and your newborn baby safe. You and your medical provider want your baby to be safe and healthy. So at this time, while you're taking good care of yourself and eating healthy, taking walks, please be careful to avoid unnecessary contact with other people. Please arrange for somebody else to do the grocery shopping and errands to keep you and your baby safe during this time. We are a community that has survived fires and floods. We're pulling together yet again and social distancing to try to keep everyone safe and healthy. While we know this is a stressful time, we're so happy to do everything we can to try to help you have a healthy baby. Thank you.